Good morning. Good morning. Welcome. It is time for CBD with my favorite PhD and certainly your favorite PhD. Good morning, Dr. Rozakis. How are you, Dr. Kat?
I couldn't be better today. I have to say
Good.
today, October is a great month and it's a great day.
And why would that be a great month?
Well, as people who are watching today and have gotten a little preview know that it is Breast Cancer Awareness Month. And this is my birthday month. It's the month of my beginning anniversary of my chemo. And every moment since my diagnosis of honoring every second that I'm alive. So how can I not be excited? And most of all, what are we doing here, Carmen? We're
Right.
helping people. And
Correct.
I have a quest, and that is if I can teach people, if we can work on prevention, we can save lives.
That's
Statistics show that even though cancer rates and deaths remain the same, for women over 50, we have decreased the death rate tremendously. And
that's
so, yeah, and I'll share some statistics with you as we go along.
wonderful. So, as you may have guessed, because this is Breast Cancer Awareness Month, we will be talking about the benefits of CBD and cancer. And we have a series for this month that we'd like to present to you. So, we're going to break it down into these segments. Today's segment is about education, as usual, the norm. But further down the road in the month, Dr. Kat, if you would be willing to, I'm just going to maybe put you on the spot a little bit right now, but would you be willing to share your personal story, the details of your cancer journey, your CBD, how you have blended this in your life, and if you wouldn't mind, maybe next week or the following week, share your personal story.
I have learned in the work that I do as a psychotherapist and taking histories, from people that our stories are everything. They're the fabric of our lives. And we have to share. And what happened to me wasn't about me. It's about everybody and everybody else who's experiencing these. So I would be very happy to share my story, Carmen.
Good.
Thank you. I think it would be only for the purpose of helping people understand that they're not alone and that, there's hope.
That's right. That's right. And for today, please share with us what you would like the rest of us to know about cancer and the benefits of CBD, hemp CBD.
That's correct. Because when we're dealing with cancer, the research goes back to marijuana, cannabis. CBD has come into the limelight as we're able to do more research and look at the different compounds. And we're learning so much more about the other compounds that are in the cannabinoid, the hemp cannabinoid plant, and that the CBD component truly is a big part of the therapeutics as, we're learning more and more. I want to talk about briefly the statistics because it is Breast Cancer Awareness Month, and we need to be aware that, breast cancer, and we're talking about breast cancer today, but the information we will be discussing does apply to other cancers as well.
Okay.
But I'll be honing in on breast cancer because in honor of October. 1 in 8 women will have breast cancer, and 1 in 883 men. Everybody thinks of breast cancer as belonging as a disease for women, but men, get breast cancer as well. And, sometimes they will see something and override it because they're not aware, because we do have, benign things and cysts. And so this is very important. And that's why we're going to be talking about the importance of self-checks for both men and women. We do know that self-checks have saved lives, and you'll know in my story that was the primary, above and beyond everything else, that drove me to go in for a test. But during COVID, a lot of people are not going in to see their doctors. They're postponing. They don't want to go near a hospital. There's so much other things going on that sometimes we can get distracted. Please do not miss your appointments, and make sure you do your self checks. It will save your life. Statistics show that it will increase to share your lives.
Yeah, I am heeding your advice, I promise.
Okay.
I'm in the process of getting all that done.
So when we think of cancer and CBD, there are two things. One of them is, what is cancer? What are the effects of cancer on someone? Primarily when people are having their treatments, they can have a decrease in appetite. They can have sleep disturbances, anxiety. I mean, who's not going to have worry and anxiety? Even though I celebrate my life every single day, if there is something that I get like a little unusual feeling, my mind goes there, and I have to remind myself that it's normal. So the anxiety is there. There's depression, and it's grief related, and body pains. These are just a few of the symptoms that people experience. However, there's a lot of people who discuss using CBD as a way of cancer prevention or helping combat fighting cancer. And research has shown that in animals, it can provoke cell death in cancer. And, there needs to be more research. There needs to be more research in humans. We do know that the FDA has not yet approved anything with the CBD, but there is so much research in it and so much interest because of what's happening. The World Health Organization, WHO, says that it has a safe profile. It has looked at it. They say that it has very little side effects, if any. And if it does have side effects, it could be the medication that you're on that is causing the side effects and not the CBD. So we're moving along. I mean, the WHO's getting involved, it's so much. But I want to say that it is not advised to use CBD as a treatment. You can use it as an adjunct or as an ancillary with it. Let me see, I got some here. Oh, it's very important, again, because we're talking about non-toxic, to use the CBD, as we've been saying over and over again, that's pure.
Right.
A CBD that's organic. You don't want to just go get any CBD. You have to be able to know the labeling, to know what that means. We're talking about removing toxins from our bodies, anything that can cause harm. And so you want something that's pure, full spectrum. And most recently, what we've been carrying at the office, where there's a lot of research going on, and you heard me say this a few episodes before, is the CBDA, which we know is helping a little bit more with anxiety, with nausea. It's very promising, and I'm very excited about it.
Great. This is all good news. And I'm hoping that, like we try to do every week that we are here together, is we're trying to disseminate this information in short webisodes so that it's digestible, and then people can take it, take this information, and if they want more information, they can contact you. They can, reach out to you. How do they do that, Dr. Kat? How do they reach you?
Oh, thank you, Carmen. It is important that you do reach out. I'm also a psycho-oncologist, which means that I have taken courses. I've been certified to help people who are going through cancer, help them and their families from a psychological perspective, and to help them learn how to collaborate care. And we have another psycho-oncologist at the office. We also have CBD consultants. I myself am a CBD therapist, an educator, a consultant. I help educate people and certify them in the CBD realm. We have Veronica, who's a CBD coach consultant, and we have Michelle, who's a medical CBD RN. Both of them are RNs. And so we are here, and it's very important that you do reach out. The other thing I think it's important, since we're going to be having more cancer discussions this month, please, you guys, you've been great, sending private messages, asking questions, throw them on Facebook. You don't have to make them personal. You can be asking about somebody else, but that's what we're here for. And I can't promise we can answer all your questions, but we will tackle the ones that are most common and that can be the most helpful. So when you post your questions, you're helping the cause.
Right.
Oh,
Absolutely.
and you insight4wellness.com 925-216-3510. Sorry, thanks.
That's okay. That's okay. Yes, of course. We absolutely welcome your questions and feedback and comments. We might even feature you in an upcoming episode. We'll go today, Dr. Kat. You having events that people could maybe be preparing themselves for?
You froze. So preparing for them. Sorry, did you say events?
Yes.
Do we have? Oh, yes. Are you talking about the summit?
Yes.
Oh, okay. There's a summit coming out. It's the Green Plant Summit, and it's going to be in November. And please send us your email addresses. We're going to be sending email addresses. It's going to be speakers from around the United States. They're all professionals, and they're going to tackle different areas of CBD and health. You can't miss it. It's going to be a wonderful event. It's going to be free. It's going to be live, and it's also available to see at your pace for about a week after the summit. And we're going to send you information, but I need your email addresses.
There you go. Thank you, Dr. Kat. And of course, you are one of the featured speakers.
Yes.
That's why we're talking about this, and we're letting you know in advance, and more information will be coming. So
yes.
I think that pretty much wraps it up for today, unless you have something else, Dr. Kat.
No, I don't. I just want to, again, remind people to stay aware and to share because this is prevention. And prevention is all about education and communication.
Great. Thank you, everybody, for tuning in. As always, we will see you next Monday with more cancer and the benefits of CBD with Dr. Kat.
Thank you, everybody. Bye, Carmen.
Bye-bye.